Welcome to the Living Well series. My name is Hema Sani and I'm a librarian with Plano Public Library. Before we get started, we are going to wait a few more minutes to allow time for people to join and go over some housekeeping reminders. Note that this program is being recorded and will be made available on the Plano Public Library YouTube page for later viewing. Soliciting business or selling merchandise during library virtual programs is prohibited. Please show respect for our presenters and one another throughout the program. Participants' microphone and video camera options are turned off. If you have any questions or comments, please type them into the chat section. Our staff will be monitoring the chat to assist with any tech issues and bring questions to the presenter's attention. We will also be sure to leave some time for questions at the end. Keeping our mind and body active and engaged is important. Plano Public Library is pleased to partner with several organizations with resources to assist you, along with opportunities to learn something new at the library. These Living Well programs will connect you with information, programs, and services to assist you in getting the most out of life. Today, we have Beth Appleby from the Alzheimer's Association of North Texas to share tips for making difficult conversation about dementia easier. Beth Appleby is a realtor with Abby Halliday and a longtime volunteer with the Alzheimer's Association. She has personal experience dealing with dementia in her own family and currently provides resources and support for families all over the DFW area. Thanks for being with us today, Beth.
Beth,
I
you're
think
on
you're
mute.
muted. Yeah, we can't hear you, Beth.
There you go. Thank you so much. I'm very happy to be here. So are we ready to get started?
Yes.
Okay. All right. And can everyone see my screen?
Not yet. Did you press share screen? We don't see any.
Let's see what's happened. Hold on one second. We just had it. Not now?
No.
No, we cannot see.
Let's see.
Can you go back?
How about there we go. Now you got it.
Perfect.
Okay, thanks so much for being patient with me because I'm trying to do this from the car. Anyway, it's already been a crazy day and that happens. So welcome to our presentation. If you have questions, put them in the chat and at the end I'll try to address as many as I can. I know we all get questions when we're going through this and so I'm going to try to do the best I can to answer your questions, or you can contact us at the Alzheimer's Association and we'll get you the help you need. Let's start with dementia conversations. Big topics, very important topics. This presentation I so wish I had when I was taking care of my father, because I go through this and think so many times, had we addressed these issues in the very beginning stages of his Alzheimer's, it would have drastically changed the way we took care of him and the journey that he went on, and all of us went along with him. So there are discussions that are never easy. When you begin to see somebody show signs that maybe that we're having some memory problems, maybe we might be showing some signs of aging or dementia. Remember, dementia is not a characteristic of aging, but we all in our minds equate it to that. So when we get into this very uncomfortable situation, how do we approach it and what do we do? This presentation is going to help give you some great tips and ideas on what to do. What are the most difficult conversations? One, going to the doctor, a big one. When is it time to stop driving? And the one that's going to dictate almost everything you do from this point forward is making the legal and financial plans to cover future needs. And why do I say that? I do a monthly support group every month when I meet with people. It's always the same questions. They want to know about care. They want to know about expenses. They want to know about how to take care of things. And it really comes down to what legally can be done and financially what you can afford. And they kind of go hand in hand. So we're really going to delve a little bit into that. We will provide tips on how to break the ice with some of these very difficult conversations. We're going to help you plan ahead and build a care team. Then you all have a communication plan. We're going to give you opportunities to hear from people who are dealing with similar issues. The people that they have on these videos actually have really gone through this and what they're doing. And at the end, we'll make sure you have resources to help you. Remember, the Alzheimer's Association is always there 24 hours a day, 7 days a week. We love to be there to help you. So you can call at 2 o'clock in the morning. Someone will answer the phone and give you some guidance. So you may not think of yourself as a caregiver. If you are on this call, you're at this presentation, chances are you are in some way, shape, or form a care provider for somebody with dementia or Alzheimer's. And even for me, when I was in Texas, I did not see myself as a caregiver because my father lived in Maryland. And it wasn't until he passed away at the funeral that somebody said to me, "You were the best babysitter your father could ever have." Because I would phone call babysit, meaning when my mom needed a break, she'd put my dad on the phone with me and I would talk with him. And that gave her enough time to put in the laundry, maybe run to the mailbox, do whatever she needed. And she knew dad was happily distracted. And as time progressed, our phone conversations definitely changed dramatically, but it bought her time. So yes, even I was a caregiver for him all the way from Texas. So here are some things we hear. You know, my sister lives close by, she can help. That was a big one in our family. She has always been fiercely independent. And if I step in, she'll be offended. Yes, they're going to be offended, but you need to step in. "I'm fine." This is what your loved one's going to say. "Don't worry about me." Or I love this one, "Wait till you get to be my age." I hear this from my mother-in-law all the time. "Oh, just wait till you get to be my age." If you are hearing that, chances are there are some things that are going on that they are frustrated with themselves, and it might be time to have a deeper conversation. Sometimes our family members say they don't need our help. Sometimes we assume they don't need our help. Most of the time, we hope that somebody else in the family is doing the heavy lifting for us. That is, they're looking into it, they're doing the calling, they're doing the intervention. And unless we all get together and on the same page, then we're not sure really what's going on. So how do we begin? Well, let's start with sooner is better. So even though mom or dad seems to be physically fine, they seem to be physically healthy, you're just starting to see things. For my dad, it was our daily 10 o'clock in the morning conversation where he went from being very politically, you know, he watched the news, we were going to talk politics, we're going to talk weather, we're going to talk about the kids, to, you know, I don't know, my mind just doesn't seem to be the way it used to be. That was a huge trigger. I should have had conversations from that point immediately, and I didn't. I would say things like, "Well, Dad, you're probably just tired. Well, Dad, you worked really hard. I'm sure you're just, you know, your brain is tired." Why was I telling my father his brain was tired? That is a terrible thing to tell your father. I should have been saying, "Dad, if you're worried, how about I come home? Let's get to the doctors. How about I talk to mom?" Because remember, your loved one, they're probably just as scared as you are. And so they're going to make great excuses and do things that maybe are not the best. So you have to develop a plan, and you have to develop a plan using finesse. And why do we say using finesse? So this is a very difficult place to be, whether you're at the early stages or your loved one is really going rapidly into Alzheimer's or somewhere in between. Nobody wants to be told they're losing their mind. We just don't. And nobody wants to have to deal with it. I have a sister who is in healthcare. She's ran a bazillion nursing homes, super bright woman. She is probably the last of our family to admit that dad had Alzheimer's, even though she deals with it every day. And that is why, because she does deal with it every day, she didn't want it to be her dad. So she was probably the one who had the most ability to help us, and yet was the least able to help us emotionally. So get your family together. let's use a little finesse. For example, let's just use words that are more positive than negative. Not, oh my gosh, you're losing your mind, but, oh, we have some things to talk about. You're getting older and I'm really busy. And I don't know that we have actually gotten together and had have we ever had a conversation, Dad, about what a plan is for you? If you have some health conditions or you have some health issues that come up, we need to kind of have a plan in place. It's a great way to say it. You don't have to say, Dad, you're losing your mind, and so I want to have a conversation. That would not be finesse. But saying, hey, I would love to get together with you, Dad, and let's sit down and let's draw up some plans for what if this happens or what if that happens, because you're at a point in your life where these things can really happen. So, that kind of opens the door for discussion. And of course, they're liable to say no because they don't want to think about what ifs. Nobody wants to think about what ifs. And so then you have to think about ways to get past their fears. And so we need to have a couple different scenarios that we're going to put in place and kind of write out ahead of time, and ways the conversation could go and how you're going to work around it. So first things first, to get you started on that, you're going to start note taking. And what I mean is you're going to get a little notepad or on your phone in your notes app or whatever you have. And when you have conversations or you visit Dad and you notice that the mail is stacking up, or you notice that bills aren't getting paid on time, or you're having conversations and he's forgetting things, you're going to take copious notes. You're going to go home and you're going to write this. Dad didn't remember the names of the kids. Dad forgot to feed the dog, put the date and the time. Dad hasn't paid the electric bill. This is not like Dad. Dad always pays the electric bill on the 15th of every month. Dad didn't pay the electric bill. You're going to start putting together a diary of notes. And why are you going to do these notes? Okay. One, you're going to use them when you have your conversation with your loved one. And two, you're going to share them with the doctor when you finally do get in with the doctor's appointment. The more, it's just like at work, in the workplace, we always say document, document, document. The more you document, the better you're going to be equipped to help everybody, whether you're convincing your family or you're convincing your actual parent or loved one that you're dealing with, your spouse or your parent or your neighbor, whoever it is that you're dealing with. And when you go to the doctor, those notes that may not seem super important to you, okay, so we forgot to feed the dog. But if you are writing these notes and you begin to see patterns, doctors are really good when they see those patterns in writing of getting right to getting you a diagnosis on what you need. So take notes, okay? Times and dates, really important. You might even scribble down things like weather, health. Were they tired, or was it a sunny day? Was it a rainy day? All of those things really make a difference later on. So please take really, really good notes. And then you're going to practice your conversations in advance. So if this is just the initial conversation with, I think that you may be showing signs of dementia or Alzheimer's, you're going to have that conversation in your mirror with your best friend at the coffee shop in advance with your siblings. You're going to call your sister. I called my sister Mary and lived in Pennsylvania. I'm like, Mary, I'm really worried about Dad. She's like, yeah, me too. I'm like, okay. So we started having conversations. How are we going to approach this? She goes, well, we have to talk to Mom. Oh my gosh. No, we're all drawing straws. Nobody want to talk to Mom about it. Mary was crying. Mom's not going to believe us. Well, funny thing, Mom was having the same feeling. So we did a whole family phone call. Everybody got on. We all talked to Mom. Mom, what are you going to do? Mom was going to be the bad person. She was going to make the appointment and go to the doctor with Dad. So we had a plan in place. So it is really important that you don't just pop into somebody's house, whether it's Dad or Mom or it's your spouse or your best friend, and you don't just sit down and go, hey, you have dementia. That's going to get you nowhere. So instead, you're going to think of very nice ways to say, hey, I've been noticing over the past 2 weeks, or I've been noticing over the past month, or I've been noticing, when I come to town to visit, that I've noticed changes. And these are some things that we need to talk about. And you're going to take out your I statements, okay? So when you practice in advance, you want to make sure that you are not talking about you, And what you're going to do is highlight, when I came to town, I noticed when I was over at your house the other day, Dad, I really missed seeing you do, I didn't see that the dog got fed. Not, you didn't feed the dog. I noticed that some bills look like they weren't being paid. Do you need some help with that? Super nice ways that you make it more what you're doing. And so you don't put them on the defensive, and they don't have to feel like they are now protecting themselves by saying I. Okay, and then talking when you are both relaxed and comfortable is super important. My sister Debbie, who is a wonderful person, has this habit of zipping in when it's convenient to her, which is usually like 5 o'clock in the afternoon, comes in on her heels, opens the door, slams in, hey, I've got 10 minutes. I am here. What do you need? I'm going to run to the store, blah, blah, blah. Everything is fast, furious. This is how she lives her life. We love her to pieces, but the girl's always on the go. If we had let her be the one to go in and say, Dad, I'm worried about you, it would have been a 10-minute, Dad, you're losing your mind. This is what you have to do. I got to go. Goodbye. That would be so catastrophic. We really don't want that catastrophe going. So think of a couple of things. So the first, you want to think about time of day. When is it that your loved one is the most alert and comfortable? Are they a morning person? If they're having dementia and Alzheimer's, they're probably not an evening person. They might be a lunchtime person. You might want to take them to lunch. You might want to do something that's fun and different. You might want to go sit in the park. Maybe there's a favorite place they like to go. And you start with, I'm a little bit worried. I've been noticing. That is going to be the best way to do it. Everyone's comfortable. Everyone's relaxed. And then you introduce this idea. So after you introduce the idea of, oh my gosh, okay, I'm a little worried. What should we do? Well, really what we need to do is we need to get into the doctor, because the doctor can help us decide whether this is something worth worrying about or not. And remember, you're going to use the I statements again. You're going to say, please, can you go to the doctors for me? You're doing it for me. Can you go for me just so I feel better? If the doctor says everything's great, I'm going to feel better and I'm going to sleep better and I'm going to know that the doctor said everything's great and we don't have to worry yet. Can you do this for me? But we run into problems with people like, oh no, I can't afford to go to the doctors. My insurance isn't going to cover it. I don't have anything wrong with me. Remember that every year, everybody gets a free checkup. Medicaid pays for free checkup. There are ways to get in and get a free checkup. So you can always use that as an excuse. Hey, have you had a checkup? And I hate to say it, but now that we have all this COVID stuff going on, use COVID to your advantage. Hey, we should go in and check, because you had COVID so many months ago and I hear all these things about lasting effects about COVID. Maybe we should check in with your doctor and make sure everything's going well. Then you can get in and broach the topic of, while we're here, let's ask the doctor about some memory issues I've been noticing. So the other thing that we worry about, okay, so conversations going to the doctor, there's always the fear, right? They're going to be afraid. If they are noticing it too, they're going to be scared. There's going to be anger, like, oh my gosh, you can't make me, I'm not going. And people are definitely afraid of a stigma. They're afraid that if they go and they're told that yes, they are losing their mind, that the whole family is going to think of them differently, that you're instantly going to put them in a nursing home, that you're going to take their freedoms and everything away from them. So those are things you need to kind of tiptoe around and be very careful about. Let's keep it doctor focused. Let's keep it with, let's get to the doctor. We're going to have a checkup. We're going to check on some things. We're going to see what the doctor says. Then we can have a good plan, Dad, on where we're moving forward with you as you're aging. Not where we're moving forward with you because you're losing your mind, but where are we moving forward with you, Dad, as you're aging? Let's get a plan in place. And so we know we can stay on top of everything so that you can stay here and be as comfortable and safe as possible as you're starting to age and we're going on this journey together. Let's listen to Donna because she knows firsthand the importance about getting help.
I think you have to be honest. I think that's the important thing. Get a loved one to the doctor. I think you just need to be candid and honest of what are you trying to do. We're trying to understand what we're up against. It's just so important to do that, because you can't battle something that you don't know what you're battling. Again, it could have been, may not have been Alzheimer's. It could have been depression. It could have been so many other things. And guess what? There's other things you can do to take care of those issues as well. But that's what you need to be able to do. You can't ignore something. It's not going to go away.
So I love when she says you can't ignore something, because really, honestly, I ignored Dad's signs. And I struggle with that. He passed away in 2017. So 5 years later, whenever I do these presentations for the Alzheimer's Association, I have this little inner conflict, because I heard him say to me many times, I think I'm losing my mind. And I did nothing with that information until it was so bad that I finally had conversations with the rest of my family to say, hey, I know I'm in Texas, but is Dad really losing his mind? And by then, it was really bad. So don't ignore it. Don't be afraid. Yes, it's awkward. Let's just use going to the doctor as a stepping stone to get him there. Because like she said, a lot of times it's not Alzheimer's or dementia at all. Sometimes urinary tract infections can cause issues. Sometimes our drinking habits or a lack of drinking habits can cause issues. There are so many things that can cause little changes in our behaviors that have nothing to do with anything big, scary, or critical. And the doctor is the best person to help us figure that out. So using words that are comfortable for that person, knowing who you're talking to. We at work all the time, whether you're in an office, you're in a classroom, you're in a hospital, whatever your employment is, whether you are working or not working anymore, we know that talking to your audience is critical, right? Knowing who you're speaking to and speaking so that they understand. This goes with your loved one. If it's a mom or dad, if it's a spouse, if it's a sibling, know who you're talking to. Remind yourself, who is this person? And talk to them the way they're used to being talked to. Don't talk down to them. Don't be negative. I'm using all these negative words. Don't. What do we need to do? We need to be positive. We need to be encouraging. We need to be supportive. And that's hard to do when you're scared. So, like I said, we're going to suggest Medicare's free annual wellness visit. Super easy thing to do. And let's face it, we all, because I teach this in my Healthy Living for the Brain and Body, we all need to know our numbers. We all should get our annual visits. I just did mine. It's never fun because, they always find something. Your blood pressure could be lower, your weight could be lower, your cholesterol could be lower. There's always something to improve on, but that's what we pay the doctor for. So use that as an excuse to get there and do something fun with it. I've been doing this with my children since they were babies. We're going to go to the doctors and then we're going to go to the zoo. We're going to go to the doctors and then we're going to go get lunch. So maybe you're not going to take your loved one to the zoo. I did that with children. But let's face it, you got to take time off to get them to the doctors. You may as well take an extra 30 minutes and hit Dairy Queen and have some ice cream together afterwards. Figure out something that is fun and enjoyable. It doesn't have to be expensive. It doesn't have to be long, but something to follow it up with so that you still have time to connect to each other and you're not leaving each other in an upsetting and disturbing way. And then let's get the whole family involved. And this really, I think this slide actually needs to be number one over here. So we're going to communicate with everybody. Before you have the conversation, you're going to communicate with the family. Because chances are, if you're having problems, everybody else is too. You can all start comparing notes. You can all start writing notes. And then you're going to itemize those notes and questions, and you're going to take them with you to the doctor. Okay. Worst case scenario is the therapeutic fib. We use this in our support group all the time. Every time I have support group and somebody comes in and says, I am not lying to my father. I am not lying to my mother. I've never lied to my spouse. I am not going to start now. Okay. There is a huge difference between lying about spending $500 at Dillard's July sale and changing the story for a reason to get them to the doctors. What we call in Alzheimer's a therapeutic fib is really changing a story a little bit to get them, to coerce them to do, it all sounds terrible when you say it out loud, to get them to do what you want them to do. Okay. And it's hard, but sometimes you have to do that. So you might say, hey, I want you to run errands with me today, Dad, and then we're going to go get some ice cream when we're done. Oh, by the way, we're in the car and we're going to swing into Dr. Gattuso's right now because he's going to check your blood pressure for me. I got to get my blood pressure checked. He's going to check yours. My mother did it by she would schedule back-to-back appointments. So she would say, I have an appointment with Dr. Gattuso and I want you to come with me. And so she would go in first to the doctor. She called ahead of time and arranged with the doctor's office to do it this way. So she would go in and she would sign her in and she would sign him in and she'd fill out all her paperwork and she'd fill out all his paperwork and they would call her back first and he would wait in the waiting room and then they'd come and get him. And then the doctor would he was very good at switching from mom to dad. And that's how they carried all of his appointments from the very first one that she was concerned about him all the way through till the day he died. Mom always said, hey, it's my day to go see Dr. Gattuso. Will you come with me? And then we'll go have lunch. And it worked. It was a little bit of a fib because really mom didn't need to go see Dr. Gattuso, but she did. And twofold it worked out because she was able to share with the doctor what she was seeing and experiencing and all the notes she had taken without dad in the room first. And then Dr. Gattuso would bring dad back into the room and then they could have focus on dad. But now the doctor had the background information that he needed when he's examining dad. Because we remember doctors they only have a little bit of time. We all know that. They're all constrained by how much time the insurance companies tell them they can spend with each patient. So this is kind of her way of making it work. And it worked. So, get on the phone, call your doctor's office, get them to help you figure out how is the best way to work this. So, So now that we've gotten them to the doctors and we've had the conversation of, okay, this is what's going on. And we're being given a diagnosis that yes, you have early stages of Alzheimer's or you're showing signs of dementia. Then comes the question of, what do we do about driving? And that is so hard. My mother-in-law is 93 years old. Her mind is crystal clear. That woman, actually, she called me the other day and said, do you have Google? I said, yes, I have Google, Mom. No, like the Google that you talk to at home. I said, yes, I have a Google at home. Oh, tell Google to play this song. And she tells me this name of a song. I don't know. It was a nice little Christian music song. It was great. She said, I tell Google every day, I have a list of songs, and every day I have my songs that Google plays for me. I almost died. She's 93. She is mastering Google playing her songs better than I ever would. And she gave me the list of songs. So now I have a playing list for my Google while I'm at home doing the dishes, because this is what mom says we need to listen to. However, we do not put her behind the wheel anymore. Why? Because even though her mind is crystal clear, her reactions are slow, her physical ability to move is slow. She cannot turn to the left. She couldn't turn her head to look out the side of her car to see what's coming down from her if she tried. She's older. Her body is changing. She can't do it. So whether this is for dementia or Alzheimer's or just an elderly person at all, these driving tips are going to help you. So let's start with, have you noticed? Accidents. They don't have to be giant accidents. Matter of fact, most of the time, they're going to be little accidents that you don't hear about. Little accidents like, oh, I hit the mailbox. Oh, I bumped into the back of their car at a stoplight. oh, I backed into their car in the parking lot. It doesn't have to be a tremendous, oh my gosh, you flipped the car and now you're in, been medevaced to down to Dallas. That's not what we're necessarily looking for. We're looking for the little subtle changes, scrapes on the car. You're going to notice scrapes on the car, dings on the car. I remember my father-in-law just really getting mad at my husband because we went to visit him and my husband was doing like a walk around the car. Like, when you rent a car and you have the rental car people and they have the little notebook and they walk around and you're supposed to like list all the scrapes and dings you see before you actually rent the car. And I don't think they do that a whole bunch like they used to. But anyway, he's like, what are you doing? Why are you examining my car? And he turned and looked at his dad and he said, Dad, you have never had a scrape on your car as long as I can remember. You've never let anything scrape your car. And if you did, you got it taken care of immediately. And you have scrapes on your car, Dad, and these are not little scrapes. We knew then that Dad's ability to manage his car in traffic and in parking lots and going down roads was not what it used to be. And it was time to turn in the keys. Traffic tickets, again, might not be what you're expecting. Is Dad getting a ticket for going 85 down 75? Probably not. Is Dad getting a ticket for turning in the wrong lane, for going the wrong way down a one-way street, for not yielding when he's supposed to yield, for cutting somebody off? These are all the kinds of tickets that you're going to notice. For driving with a blinker and then turning the opposite direction. All of these odd little tickets, those are the things that you're probably going to notice more than anything. And then if you're with them, mistakes while driving. Let's take a listen to Chris and hear what he has to say about his dad.
There's no exact answer on this stop driving. You can tell when coming up to an intersection, as an example, the ability to understand what's going on around you was starting to deteriorate a little bit. Being on the highway with cars on both sides becomes a little more difficult. And first and foremost, the safety of everybody in the car, as well as other drivers on the road. You think about that and you want to make sure you're not putting anybody in danger. But then the difficult part is telling your dad, who you love, and he loves driving, and he's used to it, that he can no longer do that. But then even then, taking the keys away full time was very difficult. The doctor was very helpful and just saying, medically, you can't do this anymore. But my mother had the hardest time with this because she knew how much this was going to hurt him as well. And this is one of the first things that we had to deal with as a family when it came to telling my dad that he had to stop doing something because of this disease. That meant a lot to him.
So Chris in this video picks on two things very, very important. Number one was, okay, this is your dad, right? And this is very hard. I have a 17-year-old daughter at home, and it's very easy for me to say to her, no, you're not driving there, because she's 17. One of the ways that we have learned to approach it, whether it's with my husband's parents who never had any dementia or my dad who did, was that we approached it from their sense of responsibility in that, hey, if you thought that I was driving dangerous and I was going to hurt someone, Dad, you wouldn't let me do it. And I know you think you still have control, but you could never live with yourself if you caused an accident that hurt somebody. I know you, and I know you couldn't. So I turn it around with not, oh my God, you're going to be hurt, but what would you do, Dad, if you really did hurt somebody? It might be a scrape on the car today, but what would you do if you actually hurt somebody? And they start to think about it, and they take on a little bit more of, they're right. I need to start, thinking about where I'm going and what I'm doing, and maybe we need to have a different plan of action. The other thing that he picked up on that video was the fact that it hurt Mom more than Dad. They were taking the keys away from Dad, but Mom had the hardest time with it. In our house, it was my brother. He had a really hard time taking Dad's truck because it became that we couldn't just take the key from Dad. We had to remove the truck from the house. Seeing the truck upset him. He wanted to be able to drive. And so we actually took the truck to my brother's house. That was so traumatic on my brother because it was that realization that dad is aging beyond what we really want. We all know parents get old, but this was a huge step in dad is aging. So again, we want to plan ahead. We want to have something in action before that accident happens. You don't want to wait. Doctors sometimes are very helpful, and other times I've heard people say the doctor won't do it. And I'm sorry to hear that, because I really wish the doctor would. But if your doctor won't do it, then again, you got to team up as a family. You all have to do this together, and everybody has to be on board, and you have to plan ahead. You have to explain why. Let's be honest, if they know that it takes them 10 minutes to get out of the chair, to get across the floor, then you have to appeal to their absolute sense of reality here. Can you really turn your head, Dad, to see out the back of the car, or to check your blind spots? Can you move your foot fast enough from the gas to the brake to stop quickly? And in this growing area, if you're in Plano and Dallas, it doesn't take much to go, hey, I'm having a hard time with the 6 lanes of traffic turning in 6 million directions, and all of these people coming from out of the country and not knowing where they're going and cutting me off. So maybe this is not the best time for you to be driving anymore, Dad, in all this chaos and confusion. And then what we want to do, oh wait, let me go back one real quick. What we want to do is definitely have some alternatives to what are we going to give to Dad as an alternative to him driving. Okay, so now let's listen to Sheila.
Some tips on having the conversation is pointing out, especially for my father, the potential danger to others that it may cause if he's behind the wheel. And, just talking about it from the standpoint that this is not only the best thing for you, but this is also the best thing for others around you. And these are some of the alternatives, making sure that, this is what's going to happen, having a plan. If mom can't take you, then Uncle Thomas or some, will be here to take you, and we will make sure that you're getting out of the house and that you're doing some things. So, presenting the bad news, but then also presenting the plan. And for my father, that's really, really important to have a plan.
Having a plan is important for most fathers. So definitely having alternate plans for transportation. For my mother-in-law in Maryland, we have a girl, Rita. I have never met Rita because I haven't been to Maryland recently to meet her, but Rita is mom's official driver. She comes, we plan ahead. Hey, mom has a doctor's appointment on Thursday at 10. Great. Rita's set up to take care of her. Mom wants to go to the grocery store. Mom and Rita now text each other back and forth. Rita is great. She checks in all the time to say, hey, I'm going to be in the area. Is there someplace you need to go? And she's not, I don't know. She charges like $10 an hour or something. This is no big deal. Rita is awesome. So there are lots of things out there and opportunities. You just have to get creative. You may have someone from your local church who's willing to drive mom to the grocery store once a week. You might have somebody, at the veteran house. There may be a veteran who, for a couple of dollars, would love to have the opportunity to help somebody out. So there are ways. You got to get creative and get out there and work with your other family members, set up a schedule and have plans. And then, of course, calling on the doctor to help them is really important.
Talking to somebody about stopping driving, I think it's most important to understand that that is tied to someone's independence more than most things. And so by saying you can't do this anymore is like telling the person, it's like ripping away their independence. And that doesn't feel good for anybody. I know that I've always tried to put myself in that situation. What would I think if someone was saying this to me? You don't get to do this anymore. And how would I feel? And how would I want somebody to talk to me about this? And so if you try to I think sometimes too many people try to approach it as, very punitive. And I'm doing what's right for you. So why don't you understand, without really turning the tables and putting themselves in that position, understanding, how helpless that feels to take those things away. It's important to be thoughtful about what that experience is like for the individual.
So the other thing when she said, it's very hard. This is their sense of independence and sometimes their identity. They know that they can go out and do these things. A real quick story to share. My daughter was 16 when she got diagnosed with epilepsy. She had just gotten her license to drive. And we had just started allowing her to drive a little bit further than just our little community. And so she had this great sense of independence. And then we went to the neurologist, found out that she has epilepsy, and they had to, while they were adjusting her epilepsy medicine, had to temporarily put her on no driving restrictions. And that was probably the hardest thing I have ever done, was tell this brand new licensed 16-year-old, got your license, but now I have to take it away. And so instead of just saying, this is for your own good, I sat her down and I said, this sucks for me as much as it sucks for you. And I don't want to do this. And we cried together. And I think because we were able to cry together, that she understood that I wasn't doing this because I was being a mean mom, but I was doing this to help her so that we could help her. It made things better. So many times we're afraid of our own emotions that we don't want to share other people's emotions. And in this situation, when it's a loved one that you have to be part of this for, then it's really important to let them be angry, be upset, and show that you are too. This is hard on everybody. And then let's work together, that we have options and we have choices and we're going to plan things. And then that brings us to our legal and our financial planning, which is always scary.
Financially, this disease will increase the cost of living. It's just a fact. So planning for those extra costs is that much more important than what you were planning for before. And so you have to review everything that's in place, see what changes need to be made, both legally and financially. And you have to monitor that going forward afterwards too.
So, like I said, with driving, now you're gonna take the driving away, okay? But now, and also real quick, what I learned in support group is do not cancel their insurance. Why? Because you may take their keys away, you may take their car away, but the chance that they may get into somebody else's car who doesn't know what the plan is and drive is very likely. So make sure you keep their car insurance on them until you know they really are not ever getting into another car again. Even if you change the insurance plan a little bit to save you a little bit of money, don't cancel it immediately the day you take the keys away. So, but that leads us to our whole legal and financial planning. And what are you going to do? Unfortunately, a lot of times we start having these conversations when the dementia or Alzheimer's has progressed so much so that now it is too difficult to get somebody else's name on the documents and to make the plans. So as much as we hate to delve into this, this has got to be a number one thing you do. Getting hold of the finances, getting names in place. It is very uncomfortable. They are going to fight you on it, but it's so critical. And again, it's planning ahead. And this is why we need to have these conversations so much further ahead, because if you wait, you're going to find out you're going to be in a hospital, you're going to be at a doctor's appointment, you're going to be trying to get them into nursing care, and you're going to be so limited to what you can and can't do if you don't have your things in place first. So talking about sensitive money issues, sensitive issues, legal issues is hard on a good day, right? But now you're doing it with somebody who's already dealing with dementia and Alzheimer's. It's going to be a little bit more driven by fear. And so we always have to be kind of the voice of reason and knowledge and be one step ahead. Approach the conversation from the standpoint of being the person throughout the course of the disease needing the documents. What are you going to need? So you have to say, Dad, I need to be able to take care of you the best I can. And I can't do that if I can't sign the checkbook, or I can't do that if I haven't been given power of attorney to do that. And it's not that I'm you want to make sure you're not trying to take their money over. You're not trying to tell them how to live their life. You're saying, I can't help you. They're not going to let me help you. And I always tell everyone in this story, my son, who's 25, is a horse trainer, super great kid, awesome horse trainer. Of course, he had a horse accident last year, terrible horse accident. I get the call. He's up in Oklahoma in a hospital. I jump in the car at, midnight when this is happening. And my husband and I go up there, and we cannot be told anything. So we are the parents. We are there. My son's got a rib through his lungs. That's all we know from the girlfriend. But because my son was not coherent when they took him in the hospital, but he is 25, he might be my son. He did not sign that they had authority to tell us anything. So we knew nothing until he was able to come out of it. And then they could have him give permission to share information with us. You can use that story if you'd like with your family, your loved one, your friend, whoever it is, and say, I don't ever want to be in the position where I'm standing in an emergency waiting room and they will tell me nothing because my name is not on the piece of paper. And that is exactly the position you're going to be in, whether it's your 25-year-old son or your 85-year-old father. These things need to be done. And that's how you present it. It's so important that today with HIPAA, they have to stay by their laws. They cannot give you the choices unless you have permission. So here's Julie talking about how to do it.
Come to after all of this. That is the most loving and kind thing you can do for them, is to be honest with them and say, this is like a really scary thing. And I feel a lot of discomfort bringing this up to you, but I tell them, if you're going to be the one who's going to take them on this journey, then you have to tell them, I'm going to be here on this journey with you. And there are things that we have to do to get this in place. We're going to go on this journey together. I've told you I'm going to be here with you till the end. So let's get this ready. It's like we're going to go on an ocean ship. We've got to get things packed up. We've got to figure out what we're taking with us. We got to get ready. And the things that we have to get ready, we have to make sure that we know which doctors you're going to be using. I need to get this signed, okay? So that if you go in there and they have to do surgery, for example, I got to have this durable power of attorney for healthcare for you. I have to have this worked out, okay? Now, if for some reason, okay, you need to go to rehab after something, I have to have these documents here, the financial stuff, so I can get these things taken care of for you while this is going on. I don't want to have anything get in the way of us being able to progress and keep doing this. I said, it seems hard because it's hard in our heads. Everybody's read about people who've stolen from elderly people, who've done these horrible things. But if you're the person who's approaching this with loving kindness and compassion, and you're willing to take this person on this journey, you're not doing a bad thing. You're doing the right thing by talking to them about it. And you approach it from the standpoint of, I'm here for you. I'm doing this for you. We're going to do this together. And I'm going to help you through this. And these are the tools that I need to make sure that we can do this.
And she is right. There are tools. You're going to use this as, we need these tools ahead of time. And I know that there are a lot of people out there who are afraid, well, you're just going to steal my money. Because we do hear those stories all the time. Well, you're just going to take the house. Well, you just wanted to take my car. No, that is not what you're doing. But you're not going to say no. What you're going to say is, you know what? I want to prevent anybody else from taking it. So let's do this the right way. So you have your protections built in, and I have the limited power to do what I need to do if something were to happen for you. When you do power of attorney and you sit with a lawyer and they write it out right, they will feel like they have the support and the protection that you can't just go off and run off with their car and their money and everything else. So you're going to explain you're doing this together. You're going to start by asking questions and gathering documents. Hey, where is your insurance? Whose name is on your medical card? Who are your doctors? Get a binder, start putting all this stuff together. While you're at it, take a picture of your car and your license plate, because even though you took those keys away, they may still be getting in it. Make sure you have pictures of that. Explain that there are standard plans that need to be made. We need to make sure that somebody's in charge of your finances, somebody's in charge of your health care, that we know who your doctors are, that we have a plan. If this happens, what do you want to do next? When you reach this point, Dad, where do you want to go? Do you want to stay home? My dad never wanted to be a burden to my mom. So when he reached a certain point, he knew that was his plan. He needed to go into a home and get care. Have those conversations and break the conversations into part. We don't need to tackle all this, and we tackled it all in 1 hour. You're not tackling it all in 1 hour at your loved one's house. This is a slow progression over a course of time, not too slow, because once you get that diagnosis, you really need to get this stuff in place, or you are going to be stuck out in the waiting room and not have any ability to help your loved one. But on the other hand, you don't want to bombard them all in one day. And remember, you need a team. You can't do this all on your own. So you need, whether it's siblings, it's another friend, it's a cousin, an in-law, you need to find somebody else to be on your team so that you all are doing this together as a family or as a group. And so who is in your care team? This is super important. You want to make sure, like I said, that everybody's on the same page. It's so easy today when you can do group texts and group emails. So maybe you are now found yourself as the leader of the team. Set up a group text with everybody's information in it. Set up a group email. Let everybody know. Because if you let everybody know, then there is no sister on the outside going, nobody told me. What are they really doing? I have a family right now, a very good friend of mine. The one sister in Colorado is convinced the sister here in Dallas is spending dad's money on stupid things. She's not. Everything she's doing is for her father and his health care. But the sister in Colorado has not been kept in the loop. And so I sat her down and I'm like, look, this is what you got to do. You got to have a family group chat. You got to let everybody know on Sunday night, hey, this week, dad's going to this doctor on Monday. I'm taking him to this doctor on Wednesday. He needed new meds. I had to buy him new shoes because he had to get different kinds of shoes to walk in. We're having a person come to the house to interview about taking care of the house 3 days a week. Keep them abreast of what's going on. Build your team. Then who is your medical team? Again, this is where group emails and texts come in handy. Let everybody know. If you have to type up a letter and mail it to everybody, let everybody who is involved in the care of this person know. These are all the doctors that we're seeing. These are their addresses. These are their phone numbers. These are appointment dates that we have. And again, this is where your legal is going to come in. Who has power of attorney? And when you get to these doctors, if mom or dad is still cognizant, or your spouse, have them write on the sheet. I had to do it the other day at my oncologist. I had to write on the sheet. Can we share information with? Well, shoot, I put my entire family on there and all of their phone numbers because I don't know at any given time if something happens to me, who's going to be here to take care of me? If my mom flies in and she's with Allison, if Tim's out of the country for work, then mom needs to know. I want her to have access to the information. If her name and number isn't on that piece of paper, they're not telling mom anything. So not only knowing who your medical team is, but also knowing who you're going to let share information from that medical team. Not only do you want to make sure that you have friends supporting you, but you want to make sure that their friends are not isolated and left out in this. And this is a huge thing with our senior citizens. We forget about the peer group. Everybody needs friends, okay? Everybody. They need the emotional support. They need the break in the day. They need their best friend that used to play chess with them on every Thursday, the third Thursday of every month. He needs to still come over and play chess. You might want to tell them ahead of time, hey, we're noticing these things. Chances are the friends already noticed, okay? Grandma, we only have a few minutes, but let me tell you this real quick. Grandma used to play rummy every week with a group of friends, and the one woman was losing her mind. And the group of women that played rummy, they wanted to kick her out, but they decided they couldn't kick her out because this was the one thing this woman had to live for. So they all bonded together and they just ignored her hand. It was pretty funny. But anyway, they still included her. You need to still keep those friend connections going for your loved one. And then we only have a minute left. We're going to skip to community resources because that is huge. The Alzheimer's Association is here to help you, and they have tons of resources, whether you go on their website or you call their phone number. It is amazing. You are at your library doing this. Your library is full of resources. Don't be afraid to ask for help. How can we, whoops, let's go back. How can we help you? Where did my slide go? Here we go. You're going to go to alz.org. They have support groups, they have education groups, they have resource finders. That is a tremendous help. ALZ Connected, they've got a caregiver center. Put this phone number, 800-272-3900. Put it in your phone. Put it on your refrigerator. Put it by your nightstand. Tape it across your computer. You are going to find that is such a tremendous resource. Whether you just need to get upset because you're frustrated, somebody on the other line can hear you and listen for you. If you have a question and you don't know how to find the answer, they can guide you. If you need resources, they will help you find the resources you need. And they have tons of online education. Their training is amazing. So if you don't know how to handle dressing dad anymore, you don't know how to handle feeding mom anymore, get on their ALZ, and they have so many things to help you out. This was a whole lot of information in a very short but long time. An hour is a long time to sit here and listen to me ramble. Very short, but very long. I hope it was very helpful to you. And at the end of the day, remember, there's lots of ways to get involved that will help you as a person. We have our walks. I love our walks. We just had Longest Day. Volunteering has been the best thing I ever did. It really helped me help my dad and help me deal with my own feelings of whether I cared for dad or not the best way. And we can always use advocates to help us with our legal and getting laws passed and getting funding, and that's really important as well. So there you go. You can't do it alone. You need a team, you need help, and we are always here 24 hours a day, 7 days a week to help you out. So thank you very, very much. I'm going to leave this screen up for a few minutes so that everyone has a chance to take a picture of it, screenshot it, write that number down. That's super important. Get it in your phone or in your notepad right now.
Thank you so much, Beth. I don't have any questions that I see in the chat box, but we have 2 minutes left if anybody has a question. That was really helpful information, Beth.
Awesome.
And we will be sharing some programs and resources that will be very helpful to you from Plano Public Library. Just give me a second and I'll share my screen.
Thank you, Emma. Thank you, Beth. We really appreciate your time.
You are quite welcome.
Plano Public Library offers a program called Memory Keepers for people living with early stage of dementia or Alzheimer and their care partners. Memory Keepers, offered in partnership with the Alzheimer Association, is a monthly online conversational program for people and their care partners to explore and conserve memories together. The aim of the program is to give people living with dementia or Alzheimer a comfortable space to express feelings, interact with others, remember the past, express their personality, reduce anxiety and restlessness. Library staff lead participants in guided conversation around common themes like family, friends, pets, and childhood. There is time for participants to share their experiences. All registrants receive a follow-up email with a link to library resources about dementia and Alzheimer. Meet new friends or connect in a new way with those around you by joining Connecting Seniors or a library book club. Drop into Connecting Seniors, an online program for people to get together share life experiences, stories, and memories, and have fun. Upcoming topic include Ooh Chocolate on July 7 and crossword puzzles with friends on August 4. Have a lively conversation at one of the library's online book clubs. Whatever your reading preference, there is a book club to match it and people interested to hear your thoughts. Learning something new is a great way to expand your social circle and engage with others. The Plano Public Library offers programs and classes on a variety of topics for all ages. These programs and classes do not require a library card. Participate via Zoom, watch at any time on YouTube, or take an in-person class at your nearest library. Learn about personal finance, starting a small business, pick up skills in Microsoft Word or Excel, or find out how you can check out books, audiobooks, and magazines using the Libby app on your on your tablet, phone, or computer. Find out more about everything the library has to offer at the Plano Library Learns blog, which posts engaging content and resources about art and culture, early learning, students, team learning, technology, and reading. Visit the blog for articles, recommendation, and reading list, and to learn more about online programs, classes, and book clubs. Connect with us on Facebook, YouTube, and Instagram to receive daily information about what's going on at the library. Sign up to receive Sage, a monthly e-newsletter aimed at older adults. It covers services and programs provided by City of Plano, including the library. You can also sign up for Check it out, the library's monthly e-newsletter featuring news and updates about the Plano libraries. There are so many ways to stay social at the library, right from the comfort of your own home. Virtual programs, online classes, library blog. Other Living Well programs include Dementia Friendly Program in North Texas on July 12th at 11 a.m., Staying Social on August 9 at 11 a.m. Listen and subscribe to learn more about the library, our program and services, library staff and community. Librarians Bob Lofton and Rachel Yuger talk with library staff and community experts about early learning and families, business and career building, as well as highlighting library services and staff profiles. Podcast episode premiere on the first of each month. Any questions about this program, please contact Bethany Ross at bross@plano.gov. Thank you for joining us today.